Welcome back to the show. Now, in observance of World TB Day 2025, we take a closer look, that is, at the ongoing efforts, that is, to end TB globally, tuberculosis globally, and focusing on the innovative research being conducted at the University of Namibia. Now, Associate Professor from the School of Medicine at the university and an expert in human biological and translational medical sciences actually joins us now in the studio to discuss how the university is committed, to this global health issue. Very good morning, Professor Nepolo. How are you doing this morning?
Good morning to you too, Nicole. I'm fine.
Okay.
And yourself?
Good. Thank you very much. Can't complain. I think it's fair for us maybe for you to start by telling our viewers and explaining to us the significance and the importance of a day such as World TB Day and how it ties into, these global efforts to end tuberculosis.
Yeah, thank you. I think maybe just to start off with, I think it's quite important for the viewer to know that TB is quite one of the probably the oldest disease. It was discovered, I think, on the 24th of March. That was 1882. That's almost about 150 years. And it's probably one of the deadly diseases, not only that is costing detrimental, I think, health impact to the community, but also social and economical, which that number one, probably then if you are sick with TB, it takes such a long time for you to be treated. Secondly, then you can be isolated from the community. And if you are working, then you can also be booked off from work. I think it's quite important for us to be celebrating these days. Most important is actually like to raise awareness. Yeah. And the global goal is to end TB by 2030, and that's about, I think, 5 years away from now.
Yeah. You're a very passionate individual, when it comes to tuberculosis and the fight against it, and as a leading researcher in your field, can you also describe for us some of the key ongoing projects at the university, maybe touch on some past, some of your successful projects from the past as well, and going forward, and how it's aimed at tackling, a TB such as that is H3 TB, for instance, and OASIS?
Yeah, no, thank you for that. Maybe just a brief background to say our work. As you said, we are passionate about TB. We are a group working on this. I think we started as big as, I think, 2017. Okay. It has been long going. The reason for that is to say, if you want to treat TB or to get rid of TB from the community, first of all, you need to find it. Okay? Then how do you find it? It's by doing, I think, proper diagnosis. And that's probably the challenge. And if you look at the Namibian, maybe TB reports telling you that Namibia is probably missing about 33 cases of TB which are not diagnosed. And for us, we started off to say, can we introduce a molecular diagnostic technique that can probably shorten the time it takes you to diagnose someone with TB, and hopefully you can get this person into care or TB management, and assuming that at least we shorten the time between diagnosis and patient management, then you are likely probably to have optimal outcome in terms of patient treatment.
Interesting. Let's tie in the theme for this year is actually, yes, we can end TB, commit, invest, and deliver. Very, 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 very important there. How does this theme tie in with the work of yours and your teams?
So in terms of, I think, the theme from our side is that, number one, what we try to do, just maybe to come back to your earlier question, is that we introduced what we call the molecular diagnostic sequencing for TB, not only because it can shorten that processes, and it can also tell you that the person that you are dealing with is resistant to which antibiotics. And the conventional method that we are using, most of them doesn't show you that. That's where we are starting. First of all, we want to do a proper diagnosis for this specific patient. The second one, especially with some of those projects that you mentioned, is that we want to do what we call active case finding. If someone has TB, then you want to go out there, find them, and bring them on care. And maybe something that's worth mentioning is to say our work that we've been doing for the first time for Namibia is actually using now the sequencing technology for TB diagnostic. The ministry launched the TB guideline for 2024, which I think was launched in December last year, and it will come into effect next month. For the first time, Namibia is actually going to use some of this technology that we did a proof of concept from the university, honestly, to drive or to deliver on TB treatment and hopefully to end it by 2030. What we want to find probably every single TB case in Namibia at least, and hopefully it should be under treatment. But then finding it is not good enough. Optimal treatment for this patient is quite needed. That's why the two systems, the higher institution, the government, they need to work together and complement each other so that at least we can end TB by 2030.
By 2030. I think some significant strides, I think, that the team is making there, and that's what comes out here. Now, in terms of numbers, Professor, please correct me if I'm wrong. We're saying about 460 people, over 100,000 per year, dies of tuberculosis. Or is that not accurate?
Yeah, probably that what you are mentioning, those are what we call incidence of TB per 100,000 population.
Thank you. Okay.
To put in the context, I think, of the viewers, to say from 2023 to last year, I think our TB cases, they've increased, I think, from 9,200 to 12,000. Okay. And again, maybe just to put it also in context, not only for Namibia, but globally, TB it's the top lead of, I think, death by an infectious disease. It was totally different before, during the time of COVID, because we know what COVID was doing. But after that, we know there are no more deaths by COVID, so TB have taken over. Just to put those numbers
in context.
So we are also expecting, a number of people, I think, dying from TB in Namibia.
Right. Now, we mentioned that, the team, we as a country are making strides here, and we still have our task cut out for us, for if we're looking 2030, like we said, is not far. But if we talk about some of the challenges that we face as a nation in eradicating TB, let's say both locally and internationally, what would those challenges be?
As I think I've mentioned earlier on, the first one is really to make sure that all TB cases are diagnosed, because first we need to find them. Then once those cases are diagnosed or identified, then number one, then you need to bring them under hospital or clinical management, if I can put it that way. And when you bring them under clinical management, just make sure that you have at least optimal treatment regimen, because it's pointless to diagnose someone with TB, but then you can't offer an optimal treatment regimen. Definitely, two things are likely to happen. It's either the person fail the treatment regimen because it's suboptimal, or maybe the person default because he or she get frustrated that, you know what, I've been on this for such a long time, nothing's happening, they'll maybe just go back to the community. And what we don't want someone with active TB to go to the community untreated. I think, the challenge is really to have those antibiotics to treat the patients when they need them, and getting these people on treatments on time, and this time to doing that proper diagnosis.
Thank you, Professor. We were speaking earlier about operating in silos and, on an island specifically. How important is collaboration and partnerships, especially, with international collaboration in terms of combating, the fight against TB?
Collaboration, I think, is quite key, and for the last 10 years for us from the University of Namibia, I think we've been quite collaborating with collaborators not only from Europe, America also, but most important, Africa. But to me, the key collaborators are the one locally, because what we are trying to do is what we refer to as translational research. How do we take it from the laboratory benchtop? Because they say, you call yourself a scientist, but what you want to do is really to have a direct impact to the patient. And what they're trying to do was to offer this diagnostic service to the Ministry of Health, mostly to the patient. So I've been collaborating with the Ministry of Health to say this can help, and that's why it was able to be adopted into the guidelines. That's a policy. And you can only be able to do that if you are collaborating. And most important is also that we've been working with our national public health laboratories to make sure that at least what we are doing, we are kind of not duplicating efforts, because yeah, we are a population of about 3 million people. If someone is doing perfectly well, don't do it. Then you introduce something, I think, innovative, just to impact the public health sector for Namibia.
Professor Nepolo, it was nice having you in studio here this morning. You and your team continue doing what you're doing for the nation.
Thank you for having me.
All right. There you have it, Namibia. We're talking about ending, that is, TB by 2030. And we have invited, that is, Professor Emmanuel Nepolo, who is also an expert in human and biological translational medical sciences, here in studio to talk about, that is, the fight and the efforts that the team, him and the team are, doing, that is, to fight, that is, TB. We'll be back after the break.